me share my screen. Okay. So hopefully you can see me there and then see me on the see the slides that are presented to you here. So first of all, make sure you want to turn your volumes up. And in the bottom left, I believe it's in the bottom left, you can see the Q&A button. And then that's going to allow you to ask me any questions. I'll save all the answers for these questions that come up till the very end. Well, I'll have some Q&As of my own that I've collected over the last month from all of the our prospective viewers here. So to get started, I'm Dr. Richard Kim. I'm the owner of this practice. I'm the physician in this practice. And we hold a monthly stem cell webinar, regenerative medicine webinar, to get people to understand what the basics of regenerative medicine is. There is a lot to understand and to learn and to know. Obviously, everybody comes to it from a different vantage point and a different knowledge set. But this is really for those who are considering an option for therapy that's, quite frankly, on the cutting edge. So the title of this talk here is How Stem Cells Solve Pain. We'll start off actually with a Q&A. This is Beth M. from area code 518. She's asked exactly how stem cell regenerative medicine works. And this is the big question. And I think a lot of people want to understand exactly what is it that we do and exactly how is it that this holds so much power. It's a pretty common question. I'll move on to this next question because it's very similar. Brian K. from area code 514 asks, how does spine regenerative medicine work? How does it work in all cases, and what is the success rate? So regenerative medicine really works by using cells to repair damaged tissue, and that is the simplest answer. So we use cells from your body to repair your body. And obviously, there's a lot of technical things in terms of how we get that accomplished, but that's the basics of it. There is a wide range of applications. Not all applications work. For example, if you've had a knee replacement, what we can do for you with stem cells or regenerative medicine is pretty limited. Everybody wants to know success rates. So really, this all depends on a lot of information that you're able to give me as the patient. I need to know about your symptoms. I need to know about your severity. I need to know whether or not you've had surgery in the area. And so everybody's success rate varies somewhat. But obviously, a lot of that really comes down to based on the individual. When we talk about when we have pain and how to go about solving the pain, whether it's regenerative medicine or surgery regenerative medicine or otherwise, we all have similar goals. And the goals are laid out like this. Number one, we all want to avoid surgery. We all want to avoid undergoing the knife. And then we all know about the long recovery times and the scars that come with it, the scar tissue that comes with it, etc. Number two, we want to stop medications. If your life is dependent on medications now, it's something that we want to get away from and stop using. Third, we want an improvement in our quality of life. And we want to improve our quality of life without too much impediment. The common goals here are that when we do come to a physician, we want a plan. And we want a couple of characteristics of that plan. We want a plan that's going to be safe. We want it to have low risk. We want it to have short recovery. And we want to avoid any unnecessary pitfalls. For example, really extended recovery times or costs that are just sort of insurmountable and untenable. Here's a couple familiar examples. We have in first our retired psychologist who flies airplanes for a hobby. He is also a runner. competitive, but also uses it to relieve stress. The back pain essentially ended the running, so that meant no more competition, fun, stress relief. The pain was also limiting his flying time, which was an enjoyment and hobby. Secondly, we have a chef here. The chef enjoyed spending time with the family, but the job is constant motion, moving heavy restaurant equipment. And then this pain was also affecting his work. And, noticed that the work days were now becoming increasingly difficult, and I actually contemplated changing careers. Traditionally, we were missing the target. Surgery meant it was permanent, it was invasive, long recovery, not to mention relatively poor success rates. And medications also missed the limit. Steroids, we all know, they're a Band-Aid. However, this Band-Aid weakens and damages tissue, so meaning that if you did repeat steroids, you had repeat weakening and repeat damage. Over-the-counter medications lessen the symptoms, but those effects wear off and you got to repeat the dose and you're back to square one all over again. 2 months after our stem cell therapy, psychologist was back to running. Ran the 4th of July race that we have here locally. It was a 4-mile race, ran a 13-minute per mile pace, but was happy with his time. Confidence enough to train for a half marathon with his grandson, which we see as the ultimate win in this. Chef was able to return to work, going back full time, provide for his family, and no further issues. This is the issue. This is the problem. It's about breaking the cycle. When you have pain, it leads to further degeneration. And when you have degeneration, it then leads to further pain. And then you get stuck in the cycle over and over again. And obviously, this is one of our bigger problems here. Our job is really to break that cycle. What we want to present to you is the idea of a third solution, not surgery, not medication, but a third solution. And this third solution comes with a few things. Number one, it comes with a relatively high success rate. It comes with something that a lot of therapies can't give you, which is many years of relief. And lastly, it's a guaranteed acceptance. So there's no rejection of foreign bodies, foreign tissues. It's all from you back into you. And so therefore you have this thing called the guaranteed acceptance. This graph on the side is what we typically see in patients. It is a progressive and steady improvement from the time of therapy. It just goes, and week after week, you're going to notice progressive improvement. It is not an overnight phenomenon, which is really what the other thing that you'll be noticing from that graph. So what exactly is regenerative medicine? It's a new field of medicine, and the goal here, the functional goal here, is to restore but not replace any tissues. So if you're interested in replacing tissue, this probably isn't for you. But if you're looking into restoring what you're naturally born with, what you're naturally given, what you're naturally have, this is the therapy for you to think about. This takes basically damaged tissue into healthy and functional tissue. Now we have a green, yellow, and red circle here. And then PRP covers the green and yellow, meaning sort of mild to mild moderate problems. And stem cells really we reserve for that yellow and red circle, which is sort of moderate to moderate severe problems. The two basic materials that we like to operate in or to utilize is number one, platelets, and number two, stem cells. These are the different materials. There's a couple of others, but I would say by and large that these are what we see and utilize the most. Here in this video, the red in the top right corner is bad material, the green is good. And this is what we see as cells attacking the bad area. And this is essentially what is happening when we insert stem cells into a bad knee, into a bad spine. The red is what's driving your pain, your sciatica, your nerve pain, your shooting type pains. And so you can imagine once the green attacks it and gets rid of that, you're back to normal and healthy tissue. One of my favorite ways to describe what's happening in your body is the Pac-Man problem. If you can imagine those little pellets as inflammation, the Pac-Mans eating the pellets one at a time is kind of what platelet-rich plasma or PRP does. But if you take many Pac-Man and you put it all on the screen at the same time, that's essentially what stem cells do. The goal here is not to beat the level and then play the next level. The goal here for us is to beat and leave the problem behind entirely, stop playing the game, and to leave the game behind. And when we do, we're talking about something that lasts somewhere between 5 to 10 years. And so you'll see me talk about these numbers, but really it depends on what we're treating and a couple of other factors. Where exactly do the stem cells come from? So they come from you. And when they come from you, they'll come from the back of that spinning pelvis there. So right now, that's the front. And then as it comes around, right about there, that's the back. And so there's a bony ridge that we remove the stem cells from. And for example, in the back, we're injecting it into that degenerative disc to then, of course, restore. When a patient decides to do this, this is the typical sort of timeline that it follows. Number one, we do the consultation. Number two, we'll do the MRI, which typically happens in our office. Next, we do the first platelet-rich plasma. Then we do the second platelet-rich plasma, and this is where the stem cells get involved. Then one more platelet-rich plasma. So if you're watching this, you're seeing that once you and I, as the patient and the physician, decide that we're going to do this, everything pretty much happens like clockwork. So these four next events happen pretty much one after another, but in this very logical sequence. Once we're done, physical therapy, chiropractic care, exercise is going to be what's involved. It's just the progression and improvement somewhere between injections number 2 and 3, typically. So what do we treat? If you're a patient who is dealing with something like stenosis, arthritis, degenerative disc, sciatica, these are the exact things that we talk about in our office to our patients every day, that we're addressing every day, that we're solving every day. Lower body pains, arthritis, bursitis, meniscus damage, Achilles tendon issues. What about in the upper body? Absolutely. So rotator cuff, arthritis, tennis elbow, carpal tunnel, some common issues we see. A lot of patients like to ask whether or not they're a candidate. So the basic way we like to think about this is that if it's something that can be injected or operated on, and we can get stem cells to that area. That means including from the neck to the bottom of the spine and virtually everything in between. What's important to us is the ability to make a diagnosis. And it really leads to an accurate diagnosis means that you get an accurate location, and which means that you're getting an accurate therapy. And of course, all of our therapies, in order to improve that diagnosis and location, all include an MRI. And of course, we have our own MRI to help make that happen. We also happen to be the only regenerative medicine provider with our own MRI. But what if you've had surgery? The answer, in short, is yes, we can still help. However, a consultation is important, and the type of surgery you've had is important. So what's important is diagnosis and imaging, like we mentioned in the last slide. Your history, your exam is important. The type of surgery, whether it's arthroscopy, fusion, rotator cuff, it will impact not only the sort of success you'll see, but the timeline in which you'll see results. And of course, things like total joint replacements. Unfortunately, there's very little options there. However, always a consultation is recommended. So here's a couple of frequently asked questions that we'd like to get. Where will my stem cells come from? And the stem cells always come from you, the patient, back into you, the patient. How long before I can become active? So when we hit that third injection, that third platelet-rich plasma, and as you're starting to go to physical therapy, that's when you get returned to activity. And next question, when do I feel the benefits? And the majority of the time, people are feeling benefits between the second and third injection, the second and third platelet-rich plasma. And that's, of course, very patient dependent, but I would say by and large, that's where the majority of our success is seen. How long will the tissue stay repaired? On the order of years. So anywhere from 5 to 10 years, depending on what's being injected. How well does this work? So the question about success, again, dependent on multiple factors, including what we're injecting, how severe is your symptoms, how severe does it look on either X-ray and MRI. These are some of the things that we care about. Doesn't always mean that it's the direct contributor to your success, but obviously important pieces of information. So we'll get to the question and answer section now. So Kevin S. asked from the area code 607, lower back pain relief from injury. How about looking to restore or repair the disc? So to take a small step back, when we talk about disc disease, we're talking about the jelly leaving the donut. And you can see there where the blue is the disc and the yellow is the nerve, the very close relationship between jelly and donut. So disc disease really means jelly leaving the donut, meaning when the disc material, the jelly, leaves the donut suddenly, we call that a herniation. When it leaves slowly, we call that degenerative disc disease. And of course, we're probably already thinking it. Well, when you have herniation and you have degenerative disc, you're basically just trading spots, sometimes a little bit of herniation, sometimes a little bit of degenerative disc, and going back and forth. And of course, that then leads to your chronic pain. The point of what I'm illustrating that little bit of knowledge here is that what we do helps restore the quality of the disc and repair that disc so you have a much more functional disc. And we'll get on to it. We'll see some more examples here in other questions. Christian D from area code 514 wrote in French, but I'm going to read it in English. I have a problem with my left hip, severe osteoarthritis. I want to know if it's possible to treat the problem. Thanks. So the answer is yes. There's a wide range of applications: hips, knees, shoulders, ankles. And obviously this is the alternative to having a replacement type surgery, especially if you're looking to avoid it. And it's something that can eliminate replacement surgery, not just for 5 to 10 years, like I mentioned, but since it is repeatable, it really has the potential for you to avoid replacement for the rest of your life. Victoria asks from 518, how to stop the pain? So very straightforward statement and question. But I'll go back to what I was saying before. This really is the third solution. It's not surgery. We do it right here in the office. There are no chronic medications involved. There's no, monthly subscription of something you've got to buy. Once this is done, you're done. And we like to see people yearly to come by and say hello and see how you're doing. But it is sort of a one-time thing. Stephanie from 315 said options and length of treatment. So again, this is our true alternative to surgery, especially for spine, replacement surgeries, rotator cuff surgery. So all different types of surgeries. This really represents a very safe alternative. We all know surgery really means a lengthy procedure, means a lengthy recovery, long courses of rehabilitation. And you measure those recovery and rehabs in months and years, whereas with ours, we're done within minutes to hours, and recovery is usually measured in days. And obviously, this is a much more attractive thing for you, especially if you're looking to either regain your quality of life or get back to your quality of life and activity. James and Shelly F from area code 518. My wife has bone on bone in her left knee that is painful. What is a process if calling? Please call after 3:30 on weekdays. So unfortunately, the term bone on bone is often overused, and when we have patients who come in and have somebody who's told them that what they have is bone on bone, when we look at the actual X-ray or we look at the actual MRI, the frequency is never as often as I think people or patients are led to believe. It's only a small fraction. So really, when people say bone on bone, I really need to see the image. I really need to meet the patient, and I really need to understand what their pain is, even if the diagnosis or the severity comes out to bone on bone. We have helped many in that position. So even if you feel like you have bone on bone and you're afraid that this means that you can't be eligible for this process and therapy, not true. We've helped many in that situation. Um, so because of its severity, however, if it does turn out to be bone on bone, we do often lean towards the stem cell therapy. Salima from area code 514, again in French, but the English translation is, I'd like to have an idea of the cost of treating a cervical spondylosis. Is stem cell treatment the solution, sustainable for the degenerative osteoarticular phenomenon? Do you treat yourself to this type of therapy in other countries where the cost of care is lower than the United States? So I translated the answer in French there, but the basic answer is that cervical spondylosis and degenerative osteoarticular osteoarthritis conditions respond very well to stem cell therapy, especially in the necks, especially in the low back. Personally, and I feel like this question was more directed to me. I've had my own knee, my own SI joint, my own elbows, my ankle, and my shoulder treated with platelet-rich plasma. As you can tell, I'm pretty rough on myself, and have had excellent results and short downtime, return to work, return to taking care of patients, return to going to the gym. So I can tell you, yeah, I do know what it feels like, and I can tell you how well some of these therapies work. Joseph M said from area code 514, spine pain for my mother. Again, Joseph, this is the third solution. It's not surgery. It's not medications. For a lot of people who have loved ones, it's something to think about or something to offer to them, and can hold a lot of opportunity for recovery, for regeneration, and return to activity. Mary Ann G from 315 said, my sister-in-law is in great pain most of the time. I'm sorry to hear that. She has been told she has degenerating disc and bulging disc, as well as spinal stenosis. I want to know what your methods for my own information, but also for her. So Marianne, obviously, if she's in pain, it's an important thing for me to know where that pain is coming from. But when she has degenerating disc, bulging discs, and spinal stenosis, an exam is important for me. And obviously, we'd like to run our own MRI. For you, your own information, where's your pain coming from? If it's similar to her. For us, degenerative disc disease is bread and butter for us. So we're eliminating pain from degenerative disc disease daily, if not weekly. It really has the ideal risk and benefit ratio for us or for our patients, because the risk is so small and the benefit is great. We'll get into this a little bit more here in a few minutes. But remember, for both your sister-in-law, for yourself, this is something that lasts years. And for us, it's not just something we're quoting from some literature. We've been doing it for almost 10 years now. And so when I say that we get years of relief, it's our experience with it that really helps us say that. Robert F from 914 says, I have two issues affecting my quality of life. Torn lateral meniscus, left knee, responded well to PT, but it's troubling again. Also foraminal cervical stenosis, received PT last session about 3 weeks ago before leaving for Florida. Continued my exercise and stretching to the point where knee pain outweighs my neck pain. I'm sorry to hear that. That sounds uncomfortable. Love to be able to move freely and start playing pickleball. 66, avid cyclist. can still ride, but getting up out of the saddle onto the pedals, hard, and any hard effort hurts. So number one, lateral meniscus, and for medial meniscus too, for that matter. Very common things we've treated. The meniscus tears are very, very common things we see, respond incredibly well to the type of stem cells that we do. The big thing with meniscus tear, whether it's cartilage from the articular cartilage or from meniscus cartilage, is that you're in this recurrent inflammation cycle. So between that pain degeneration cycle, you're essentially caught. The issue is that I like to use the analogy of the center post and then trying to put cement around it. When your lateral meniscus is torn, or cartilage is torn, or cartilage is damaged, your center post is sort of falling apart. And no matter how much cement you pack around it through physical therapy, through cycling, because the problem within the center is problematic, it's a constant struggle of one step forwards and sometimes two step back. And I can tell you, even those who have had surgery, it's not always necessarily fixing that center post. For us, the stenosis example is kind of like the window and extension cord. So foramen in medical terms is just basically an opening. And so you can sort of see the yellow opening above the blue disc there. And where that yellow gets sort of like larger and almost into that football shape, that's where the foramen is. So it's kind of like what I like to describe as an extension cord leaving a window. But obviously you can see when the disc creates problem, or when there's stenosis coming from the other side, it's pinching off that nerve, and that pinching off of that nerve then creates symptoms that sometimes goes all the way down to your feet. But again, our therapy, because of what we can do to the disc, because of what we can do for that window, and what we can do for stenosis, it's a pretty remarkable healing and relief process. For us, though, it's important for you to know, because you are as active as you are, that after our therapy, there are no activity restrictions. So once we're done, and after we're done with our third injection, we send you back and we send you out into activity, and no limitation on cycling, no limitation on pickleball, running, for those with meniscus tears. So quite a bit of freedom after that. William from 518 by way of some background, 78 years old, staying quite active, exercising 5 hours a week. In October of 2011, diagnosed with disc bulging at 3, 4, and 5S1 with moderate stenosis. In May of 23, was diagnosed with arthritis of the hip. And again, we see this combination frequently. Are the treatment results permanent? How long do the treatments last? What is the downtime? What are the possible problems that can arise from the treatment? And what are the success rates for the above conditions in my age category? So I'll try to go through all of these in a timely manner here. So number one, again, I said it before, but the extended relief that we are able to give people is measured in years. And even if it were to come back, totally repeatable. So let's just say it lasts you 7, 8 years, you can repeat the whole thing. Next thing is downtime. The downtime for us is measured in days, versus surgery is typically measured in months. The risks for what we do are relatively low. We're talking about, because everything happens through a needle, it's about the same level of risk for, let's say, an epidural injection. Success rates for us are generally very high, but the specifics matter. I will tell you, however, because you asked about age, age does not matter for us. We've had patients as old as 90, 95 undergo the spine stem cell process, do well. On the other end, back to driving, going grocery shopping for herself. And so age really isn't as much of a factor as I think others would have you believe. Keith from 315, dealing with neuropathy and sciatica for years. I'd like to hear about what Dr. Kim has to resolve these issues. Been to chiropractors, neurologists, neurosurgeons, concerned about the success rate and the recovery time. So again, when we talk about neuropathy and sciatica, let's review a little bit of the anatomy. That blue disc there and those two yellow sort of bulbs, that's how close the disc is to the nerves. And you can imagine if you have a disc herniation or a disc bulging into those areas, you can create what is basically neuropathy and sciatica. And so even if you've had it for years, my guess is that it's progressively worse, even if it's in a very small sort of way. Our therapy, because we're addressing the root problem. So the root problem in a lot of neuropathy and sciatica is not so much the nerve, but the disc underneath it that is pushing into the nerve. And because we're addressing the root problem, we're creating a solution that is lasting a much longer time period. Unlike epidurals or steroids, which have this very short shelf life. I will tell you, though, that nerves are time sensitive, meaning that even if you've had it for a couple years, what you don't want to do is cross over into the threshold where nerve damage then becomes permanent. And yes, that is possible. And if it does become permanent, I will tell you, doesn't matter what I do, doesn't matter what the surgeon does, it doesn't matter what the chiropractor or the neurosurgeon does, bringing back a nerve once it has had that sort of damage is sometimes not possible, and B, even if it is possible, takes an incredible amount of time. I'm talking about years to see that kind of recovery. We've had a recent similar case where a patient had what we call paresthesias, numbness and tingling down the leg. And within a few weeks was pretty quickly watching those sort of symptoms disappear. And so a lot of times we can see those sort of results fairly quickly. Christine from 518 asks, interested to learn about therapies for chronic neck, shoulder, back fascia related pains that have not been resolved by ablations, trigger points, physical therapy, chiropractic care, acupuncture. So, right. So when people have multiple pain sites, it sounds like somebody has not found the reason why you're having pain. So you've got pain in the areas, but why are you having them and where are they coming from? Obviously, a consultation is important, but some of what you're describing does sound like potentially something like a degenerative disc or arthritis or stenosis of the spine. So meaning that you sort of have a central problem, but then it's leading to neck, leading to shoulder, and leading to back fascia problems. And you're right. So you try ablations, you try trigger points, and nothing really is solving it because you're not getting to the root of the problem. And for us, because MRI is included within our therapy and in our process, it really helps us to understand what is driving any one person or patient's pain, and that's an important part to remember. Let me just say one more thing. If you're not getting an MRI or the provider is not offering you an MRI, you are probably getting suboptimal results, because if you're not knowing if the physician is not knowing where the injection is going or how best to approach that location, that matters. Deirdre and Susan both asked a similar question here. Area code 518 for Deirdre, 514 for Deirdre, 518 for Susan. More info on regenerative medicine. Had 2 spinal fusions on medications. And Susan asks, can stem cell therapy with pain after neck and back surgeries? My favorite analogy in this is something like the school project, where it's a group project. If you've ever been in that situation where you've had other partners with you, but then there are some people who don't do the work, and so now you have to do more work. That's essentially what fusion does for your spine. And what I mean by that is you develop something called the adjacent segmental disease, meaning that once you've fused one level, the level below it and the level above it now have to do increased work for the flexibility that you just lost because of that fusion. And I get it. Sometimes you have to do the fusion because there isn't a choice. But the unfortunate outcome from that is that within a few years, people then go on to develop pain again. If you actually look at a spine surgery success rates, the first, second, third, and fourth surgeries have a success rates of somewhere between 54, 30, 15, and 5%. So greatly diminishing returns. But if somebody told you, look, you had a 54% chance of success from a surgery, that's almost 1 in 2. These aren't exactly the sort of numbers that we want to see. BBB from 941 asked them about stem cell therapy for the knee. So again, broad range of applications. Spine and knee for us happen to be very common because those are also what's commonly complained of, in the community. For us, therefore, spine and knee, excellent outcomes. It's what we understand the most, understand the best. That just goes along with what we see. Richard S. from 904 says, how to deal with back pain. So, Richard, I'd say to you, look, you need to get to a consultation with us. It's more than just a chance for us to meet you and you to meet us. It really is for us a chance to find your problem. And whether that's from the spine through x-rays or MRIs, that helps us strategize and create a plan as to how exactly we're going to both find your problem and then solve it. And I think that sort of says, what you want in a doctor. You want a doctor that's going to find your problem and not just your solution. Even if you don't come to us or come to me, that's probably a good founding principle. They should be focused on the diagnosis first, always. Richard S. Is that the same one? Sorry. Somebody else asked, and I don't have the name here, asked about spina bifida occulta, spondylolisthesis, and arthritis. So spina bifida for the patient or the person who asked for this is, as you very well know, or those who are listening, it was an inherent genetic at the time of birth sort of issue. So very different than what we call spondylolisthesis and arthritis. Those two conditions are things that you developed over time. So we really need to have that conversation and to figure out where this issue is coming from and how best to help you. Severity is very important to us, especially for the spina bifida. What exactly were the long-term consequences from your spina bifida? And again, consultation is key in having that conversation with us. Denise from 607 said, just saw the commercial for us and having scoliosis, degenerative disc, multiple surgeries, implementation for spinal cord stimulators, hit a roadblock, concerned about performing any sort of surgery due to past surgeries, including spinal fusion, as you may become worse or become paralyzed. That's an unfortunate and really sort of scary outlook. They won't help me. They won't keep me on as a patient, either to monitor any changes that will occur. And I'm sorry to hear that, and sorry to hear that you sort of feel abandoned that way. For us, we have helped many with those who've had continuing pain after surgery or continued pain after stimulator. For us, what we do doesn't add any hardware. And again, what we do is, non-surgical, doesn't involve chronic medications, and has results in the last 6 to 10 years. So for things like scoliosis, something we see very commonly and help a lot of people with. And so don't let the fact that you've had surgery or stimulators placed deter you. We can still help. Richard S. from 518 says, Dear Dr. Richard Kim, can you help me if I have most of my lumbar fused? I have most of my lumbar fused. I'm 54, had a pudendal release, a piriformis syndrome release on my right side, horrible pain, buttock pain, pain and burning down the back of my leg. Outside of ankle, strapping feeling on my toes, pins and needles in my other leg, strapping feeling once in the toes, and once in a while in the toes have pins and needles, most of the time fighting this ongoing for 6 years. So So, Richard, you've got a complex problem. And as I was saying before, nerves are time dependent. It's important to know that you've got all these additional branches, some that involve the pudendal nerve or the piriformis. Um, Important information for me is, where is your fusion? Do you have any EMG information that goes along with this? And to us, two things matter when it comes to nerve damage. Number one is how long you've had it. And number two, whether or not there's a wax and wane component, meaning that sometimes it's there, sometimes it's not there. Um, and so for you, it sounds like you do have this sort of wax and wane component. I wouldn't wait much longer, Richard. I'd get a consultation with us. Let us get involved. Let us really sort of figure out where and to what severity you have. Because if there is help to be had, you want to apply it sooner rather than later. The more you delay, the more that nerve damage can obviously become permanent. Mike from Mike D from area code 585, 2 annular tears. It's been 1 year, 3 injections, looking for a solution. So, right, this is the unfortunate problem with steroids, that they're not solutions. They're these temporary band-aids. And the way we think about steroids in our office is that the first one lasts 3 months, the second one 3 weeks, and the last one 3 days. So it's diminishing returns. And you can see sort of here what a herniated disc or what an annular tear leading to a herniated disc can do. That red is sort of pushing into that nerve, and of course that nerve is meant to be a happy nerve, and instead this disc is causing inflammation, irritation, and then of course further symptoms. But for us, stem cell therapy is and I'm going to call it semi-permanent when we talk about something that lasts, up to 10 years. For us, we've treated annular tears on the regular. This is something we just even saw today, and responds incredibly well to our stem cell therapy. Paula from 514 said chronic back pain from arthritis, scoliosis, possibly degenerative disc, cortisone injection into the facet. Last one in 2022, do not want surgery. Some days the pain is above a 10. Paula, I'm sorry to hear that you're in such pain. But the pain to us in the back is kind of like a bag of sand with nails buried into it. So when you reach in and your hand hurts, you might have pointed out where one of the nails is, but then you don't know which nail it was. So you remove one and then you reach back in. What I'm trying to say is, yes, you've had a facet block, but you're talking about arthritis, scoliosis, degenerative disc. So you have all of these different things that cause pain. And if you just do a facet block, unfortunately, it's incomplete. When we do our therapies, we are comprehensive. So we are not only treating the disc, we're treating the foramen, the nerve, the tunnel, the facets, the ligaments, the muscles, the tendons. In our 3 injection series, we are injecting it all. We are chasing it all. We are addressing all of these things that create and cause your pain. So it's not surprising that you've had facet blocks and pain is either back or worse, and you don't want surgery, and I can understand that. And from 518 said, got degenerative disc, osteoarthritis between L4 to S1, as well as scoliosis. Interested to hear what Dr. Kim has done for others with my condition. So you saw in very early on the psychologist and the chef that we've helped, very similar problems that you've had. The problem with the disc, okay, so this is the problem with the disc, and you can see this sort of faint picture in the background, but the disc has cartilage above and below, and we call those cartilage layers end plates. And that's how a disc receives nutrition, through the end plates. However, when you disrupt the disc or you disrupt the end plates, the nutrition isn't getting to the disc. And so the disc just progressively degenerates, gets worse and worse over time. What we're doing is we're returning the nutrition ability for that disc. Not permanent, obviously, if you have to repeat it within 10 years, but for a long enough period of time where the disc function, your back function, your quality of life function returns. So what we want to do is not only eliminate in the inflammation, but develop the blood supply. So for us, you having scoliosis is probably a contributor, and I know somebody else asked about scoliosis. For us, scoliosis is an important thing to understand, but we want to know how severe it is, to what degree it is, how many degree bend has it caused, and is it purely lifelong, or was it from degenerative disc over time? So important questions for us and what we want to know. So Cindy S asked about from 518 asked, can I help with sciatica pain? So as you're seeing the picture here, you're going to note, I'm going to go back again, where the nerves come out of the spine and head down the body. And what I'm going to show you is that the sciatic nerve is made up of these multiple branches that come together. And sciatica can occur where the branches start, right? Or it can happen where they are all combined in your rear end, sometimes even in the back of your thigh. Sciatica just represents what you're feeling in that sciatic nerve. Now, where that problem is coming from is the other question. For a lot of our patients, they're coming from, of course, closer to the disc and up higher where the roots are. If you can imagine, the nerves are simply wires from the spinal cord down to the muscle. Sciatica is the damage along that path. So where exactly is that damage coming from? Obviously, you saw the close relationship between disc and nerve. And so creating sciatica is not a difficult thing once you have degenerative disc. Of course, for us, nerve, and I've said it before, is it temporary versus permanent damage. So a part of that is, of course, how long you've had it. And we want to know. We want to know these pieces of information because then we'll have a better understanding of how well we can help you. Juan from 315 said, will this help for my pinched nerve in C5 to C6? So exactly the same thing before. So you saw the disc relationship to nerve. And of course, this is a good time to talk about the treatment gap, where a lot of people have steroids and then there's really nothing left but then surgery. So obviously between those two stages of therapy is this giant canyon. And in order to cross it, it's this giant leap of faith. And it's also where neither the steroid nor the surgery sometimes are very good options. That's where we come in. We fill that canyon with stem cell and platelet-rich plasma. We all understand that the risk of a surgery is not small, especially up in the neck area. There's a lot of structures up here, quite important. For us, we really feel that, and we know that stem cell has that excellent risk to benefit ratio. We're talking about something with needles, no cutting, no general anesthesia, no hospitalizations, recover from home. So there's a lot of advantages here just in how these therapies compare and stack up to both steroids and surgery. Mike from 514 asked, stem cell therapy for spinal stenosis. Yes, very successful treatment reason for us, something that we treat quite commonly. But obviously for us, an evaluation is important. So we encourage you to make that consultation, that initial consultation. Mindy, area code 518, back pain for probably 25 years. Now it's in the neck, hips, leg pain, liver issues. So drugs are not an option. Sorry to hear that, Mindy. I need to be able to sleep pain-free and just be able to enjoy life more. So even if the pain, first of all, if the pain has been present for decades, that doesn't stop us. That doesn't deter us. We've helped people with 30 to 40-year-long back pains. Now, the health issue. So those with liver, kidney, lung, and heart issues are ideal for this because you don't have to go to a hospital. You don't have to undergo general anesthesia. In fact, we had somebody who brought their home oxygen today, and we did stem cells of her spine, and she was able to talk to us through it. She walked out of here on her own power, and as she continues to have that improvement, she doesn't have to have that exposure of a hospital or that exposure of general anesthesia medications. And of course, we're all talking about quality of life. You want to improve your quality of life just like all of our patients, and that's what we're focused on. Tina from 438 says, for how stem cell works, for who, the pros and cons. This is one of my favorite analogies as well. So if you can imagine that your knee, your disc, is a messy pocketbook, and a functional pocketbook, it is not, because there's such a mess in it. What stem cells do is they go into that pocketbook and they basically clean it, they organize it, they toss out all the junk, so that you have this functioning pocketbook. So you have this functioning bag. So that's essentially how stem cell works. And I showed you from the Pac-Man idea. It's sort of me saying it in just a different way. What's great about this is that this works for just about everyone. And I say almost in quotes because obviously there's a few people that it doesn't, but by and large, for almost everybody it does. The risk-benefit ratio, again, quite ideal. Damien from 518 says, what determines whether stem cells will work for my sciatica and stenosis? How long between procedure and relief? How long does it last? Cost, free assessment. So consultation will reveal the extent of your stenosis and sciatica. It's really hard to appreciate that over, a question over email. Really need to meet you in person to get that. And everybody's individual factors vary in whether or not the or how well the stem cells are going to work for them. You can see the results of stem cells as quickly as 1 to 4 weeks, typically. Not everybody, but I would say the majority of our patients are within that time frame. Again, last 6 to 10 years. And when it comes to the free assessment, I'll explain more about that in our last slide here. Beverly from 315 says herniated disc, L4 to 5, experiencing pain, sciatica, going down mostly in the leg, 7 years old. Had this problem since July 5th. So you're a little bit more recent, but I'd probably put you into the now chronic pain category. You've been dealing with this now 7 months. We talked about the difference between herniation versus degenerative disc. It's this problem where even though you have one, you're at risk for the other. And then, of course, it just slowly gets worse and worse as you bounce back and forth. Of course, nerve and time equals damage. And so therefore get that sooner evaluation rather than later. Age to us, 70-year-old is not a factor. And we've helped patients as young as 17 and as old as 95. All right, so this is our last slide here. So for being an attendee for our webinar, I'm offering for you guys a free consultation. But the one thing that I'm asking is that you call by Friday at noon. Friday at noon, our office closes. So you have a couple days here. Please mention that you saw us on the webinars and schedule that consultation. For our next webinar will be held on Wednesday, March 20th. Here's some contact information for us, 518-871-9900 for here in the States, and for the people north of us in Canada, 514-697-8919. Our webpage is richardkimmedicine.com. Our webinars, and including this webinar, which is recorded, and all future webinars, it will be found at richardkimmedicine.com/webinars. And if you're interested in just having an MRI in order to bring to us more information, you can schedule that on your own. Don't need insurance, don't need anything. The cost for us is $350 per MRI, and anybody can do it. Doesn't matter if you have insurance, not insurance, no insurance, Canadian, not Canadian, doesn't matter. And you can find that at richardkimmedicine.com/MRI. Okay, so I have 2 Q&As here, and I'm going to get to them now. Bob Bow said, what type of anesthesia do you use when performing the injections? So for us, we do not do general anesthesia. It's all local. You are meant to stay awake all the way through. And the reason for that is there are certain questions during the process where I need to ask you and you have to be able to answer me. So that's an important part for us. So being able to be conversive with us. A lot of people fall asleep because we also give them medications ahead of time. And so they do go into that sort of colonoscopy kind of twilight space, but a lot of people are still able to talk. Bobo asked a second question. You gave the timeline, but didn't say if that is in weeks or months. Yes, you're right. So, and then asked, what are the costs? So the timeline is that those 3 injections are typically done within 6 weeks. Not everybody follows that exact protocol, but that is what is general. And when you ask about cost, Baba, I don't know what we're treating. I don't know the severity of what we're treating. So for everybody, that cost is different. But obviously, when you get through a consultation with us, you will have that outlined for you. Board iPad 29. Third question here. Can we bring an MRI report from somewhere else? Absolutely. So if you do have a disc or you have an MRI report from the past, we want to know. Generally, if you have not had an MRI within the last 3 months, we do perform our own MRI because we want to get that up-to-date information as close to the stem cell date as possible to understand exactly what it is, that we're dealing with, what locations are causing your pain. Board iPad 29 put in a fourth question here. Is the PRP stem cell treatment covered by health insurance? So unfortunately, it is not. And I should back up by saying we are a direct pay practice. We do not participate with any insurances. And secondarily, there is no code to bill the insurance. And so even when we did participate in insurance, it was not something covered anyways. And that's true not just of our practice, but regenerative medicine, countrywide. So that's one of the unfortunate downsides. At some point, we hope that it will be. But as of yet, we're not there. Okay. So I'll give people a couple minutes to ask any more questions. And if you have questions, I'm happy to answer. All right. Okay, I think we're probably set then in terms of questions. Just wanted to thank everybody for attending the webinar. And again, we'd love to hear from you in scheduling a consultation. And the next webinar is March 20th. Until then, have a good rest of the week, everyone.